Thank you, Mr. Chairman. This has been an interesting hearing. I first off want to thank you all for all the efforts that you put forth during the global pandemic crisis. Dr. Tabak, you may want to talk to staff and amend your definitive answer on gain-of-function grants or sub-grants that flow through NIH. I think that would be important. Dr. Walensky, you're a medical doctor, so outside of residency, did you ever serve in a hospital as a hospitalist, a clinical practitioner, or anything like that?
I was the chief of infectious diseases at Massachusetts General Hospital for the 3 years prior to the pandemic, and clinically practiced for 25.
Thank you. Oftentimes, doctors prescribe off-label pharmaceuticals and treatments. Is that correct?
Yes.
Did you ever have an instance where the CDC directed you as a doctor, getting between you and the patient, what you could prescribe off-label?
Certainly, as you make clinical decisions, you look at guidance, but at an individual level, those guidances are intended at population
Guidance,
level.
but not directives, right?
I'm sorry?
Guidance, but not directives.
No, guidance, but not directives.
Right. So I'm concerned that during the COVID pandemic that the CDC, through various sources, and it could have been HHS funding through CMS, got between the doctor and the patient by telling doctors that you could not prescribe off-label treatments for their patients. The doctor is educated, he has clinical experience, and should be able to treat that patient however they see fit if they think that is the best. I don't care if it's a knee replacement or if it's COVID-19 treatments. That's the doctor's decision. Would you not agree with that?
I would challenge the premise that we at CDC have guidance on how, and definitive guidance on how prescribed drugs are prescribed. What I would say is that in CDC we have clinical recommendations for...
In the essence of time, let me just say that we witnessed, I talked to a lot of doctors, that they were told by the administrators of the hospital, because that was pushed down from Washington, D.C., that you couldn't prescribe certain off-label therapeutics even if the doctor felt like that was how they wanted to treat that patient.
We could have a further discussion about that, but I don't believe that was related to CDC guidance.
Then why were the doctors being told that by their administrators?
Well, so we are the public health agency, not the prescribing agency.
Was that an HHS issue? Was it a CMS issue?
I would have to defer. I don't know. I don't know who would, but it's not CDC.
There were treatments, therapeutics that were working around the globe that doctors wanted to prescribe to patients in the United States. Would you also agree that people following the guidelines of CDC that treated patients with remdesivir or whatever that died? Would you agree that patients died based on those treatments?
There are COVID-19 treatment guidelines. Those are guidelines come out of the NIH, and I'd like to pass it to Dr. Tabak, if that's okay.
So the treatment guidelines that Dr. Walensky refers to are a compilation from NIH as well as outside experts across the country.
I get guidance, sir, and I appreciate guidance. What I've been told is doctors were told they could not use certain therapeutics that they thought might be in the best interest of treating that patient and saving a life. Patients died based on the treatments that were pushed down from Washington, like remdesivir. Patients died in this world. And doctors make better decisions than when government gets in between that doctor and patient relationship. I'd love to have a further follow-up, but I agreed to yield some time to Dr. Burgess, and I yield as much time as I have left.
Gentleman yields. Dr.